The Sri Lankan parliament votes for a new president to tackle the country's economic crisis. And as countries lift restrictions and face COVID fatigue, the World Health Organization warns the pandemic is far from over. Hello, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. Well, much more on the COVID-19 pandemic later in the show, but we begin in Sri Lanka. On Wednesday, the parliament selected former Prime Minister Ranil Wickremesinghe as the country's next president after his predecessor fled the country last week and resigned by email. The island nation of 22 million people is facing an economic crisis with shortages of medicine, fuel, and food. For more on Sri Lanka's new president and the economic crisis, let's bring in our panel from the capital, Colombo. Nishan Damel is an economist and the executive director of Verite Research, and Dayan Jayatalinka has served as the ambassador of Sri Lanka to the UN in Geneva and is currently a columnist for Daily FT. Ambassador, the parliament electing this former prime minister to serve the remaining term of his predecessor who fled the country last week after resigning via email. Let's listen to what he had to say.
The economy of the country today is in a very difficult place. Young men and women are asking for change in the system. There are many problems in the world, and we must proceed without getting caught in them. To go forward, we need to come up with a new program. What the people are asking of us is not the old politics. The parliament must unite in the face of these issues.
Ambassador, you heard him say unity very important in the country. Can he unite this country?
No, he can't. The reason is that Sri Lanka is Asia's oldest democracy, even Afro-Asia's oldest democracy, and we have always popularly elected our leaders. We've never had a leader who was not popularly elected, until today, that is. Mr. Wickremesinghe did not get into the legislature, the parliament, through the popular vote. He was nominated by his party. His party did not win a single seat in parliament. He was supported by the Rajapaksa clan, whose ruling party still dominates parliament. So for the first time, you have a leader who has been elected to the powerful presidency of Sri Lanka only by the parliament. So this is a huge anomaly going by Sri Lanka's political history. Right now, we also have a very strong people's protest movement led by the youth, the millennial generation, and they're just not going to put up with this. So we are going to see much more volatility, polarization. He is not going to be able to unite people, which is troubling because we have a huge economic crisis, and he was brought in as a technocratic PM to manage that crisis. But now, because of he's got ambitious and he's been elected by the parliament, he's now the president, the leader of the country, and he doesn't have a mandate to lead anything really, because he hasn't won any election at all.
Well, Nishan, let's talk a little bit about that, because he mentioned the protest movement. We've certainly covered a lot of that in recent days. They wanted a fresh face. They wanted a fresh start. This is a man who's he was first elected to Parliament in 1977, so he's been around for a long time. Definitely not a fresh face, not a break with what the protesters want. Are you surprised that the Parliament just basically ignored their wishes, and what will be the repercussions?
I think the challenge for Sri Lanka at this time to recover from the economic crisis it is in is to recover credible, legitimate, stable political leadership. That is, of course, something that everybody is keen to see. The reason that I think the Prime Minister, who he was the Prime Minister, got elected to the presidency is because the party of the president who submitted his resignation backed him for that role. So he has, I think, a very important choice to make at this stage. He can show that, you know, the question mark around him is has he come to help the country recover credible, stable political leadership? Or has he come to help the rejected corrupt leaders to rule by proxy? And I think what Ranil Wickremesinghe does now that he's elected, and what path he takes, will allow society to place him in one side or the other of that question. And I think that will matter greatly for the stability.
Okay, let me interrupt and ask you, which column does he end up in?
Well, I think that depends on what he does. The litmus test, for instance, would he take action on corruption? Sri Lanka had a stolen asset recovery program that he himself had put into place when he was governing, that was dismantled by the recently resigned president. Will he put that program back into action? Will he reinstate the many court cases, prosecutions on corruption that were withdrawn under the recently resigned president? Will he practice transparency in his dealings with the IMF and show Parliament what the negotiations are? Now, if he takes an approach of being transparent and taking leadership in corruption and demonstrating that he's genuinely independent of the previous president, I think he has an opportunity to demonstrate that he is moving in the direction of providing legitimate, credible leadership. But otherwise, I think he runs the risk of being seen as having arrived in some way to protect or allow the rejected leaders to govern by proxy.
And Ambassador, what do you think the likelihood is of the path he's describing?
Well, today's election told the story. Mr. Wickremesinghe was unable to get a single vote from the opposition benches. So there was no sense that here is a man who should be supported by both government and opposition, a person capable of forging a national consensus. He was supported exclusively by the dominant section of the ruling party of the president, who was given 24 hours to get out of Dodge by the protesters. So at the very inception, he has shown that his support is exclusively from the old ruling party. Now, Mr. Wickremesinghe himself has been around, as you pointed out, since 1977. He's been prime minister 6 times, but of those 6 times, he was elected to that office only twice. Every other time, that's 4 times, he was appointed. So he's pretty bad at getting votes. And on the 2 occasions of 6 on which he was elected, he was a one-term prime minister, never re-elected immediately after that. And between those 2 terms, there was a 15-year interval. So he's a profoundly unpopular politician. The party that he headed, a very old party, was wiped out at the last elections. It could not elect a single member. He himself, as I said, was not elected to the parliament. So I don't see that he can act in a way that goes contrary to the interests of the old, the ruling party, because he depends entirely on that ruling party, as he showed today. And right now, the protest movement has denounced his election by parliament, or rather his selection by parliament, on the grounds that he doesn't have a mandate, which is true. I mean, if you take President Joe Biden's famous definition of democracy versus autocracy, he famously said democracies are countries in which the people elect their leaders. Now, if you go by that, then we who are Asia's oldest democracy, we are no longer a democracy.
Well, Ambassador, let me ask you about everyday Sri Lankans struggling just to get by, these long, long lines for gas, having to wait days for that. What's the first thing, if you were in government right now, that you would try and tackle? A lot of people talking about perhaps reaching out to Russia for some discounted oil. Is that the right approach? I mean, what should be the first thing on his list of things to tackle?
Reviving agriculture. Agriculture was destroyed by the former president Gotabaya Rajapaksa who absurdly instituted an overnight ban on synthetic fertilizer, pesticides, and weedicides. Now, agriculture has been the traditional base of rural singular society, Sri Lankan society, and he wrecked peasant agriculture. He's caused a food crisis and a rise in food prices. It also meant that Sri Lanka had to spend valuable hard currency importing food. And the ban on fertilizer also meant that our export crops were wrecked and we didn't get the dollars that we otherwise would have. Now, the first thing to do is to make sure that the people have food to eat. And that is to bring in, talk to whoever you have to, restore the old system of synthetic fertilizer, which the soil is accustomed to, and get agriculture going again and the rural economy capable of purchasing products. I would say the place to start is with agriculture and reviving the peasantry.
And Nishan, is that how you view it as well?
Certainly, agriculture is an important dimension of the economy that needs restoration. But there are other areas and other ways in which I think also the president has to take action and the government has to take action. For instance, the level of income under which you are poor has today almost doubled because we are running inflation at above 50% and food inflation at above 80%. By the end of the year, there is a risk that the almost half the population in Sri Lanka could be classified as poor. So organizing a system of efficient and effective cash transfers to the poor and vulnerable is going to be extremely important in terms of human survival in this period of economic crisis. And the second thing is, I think that the government needs to get Sri Lanka to emerge from this crisis, which is to restructure its debt as fast as possible. Countries that are governed well have done that in 5 to 6 months, even in the last few years. Even Ecuador did that in that time period. Sri Lanka is currently on a slow train to do it, and is going to take over a year to get that done, and maybe even 18 months, which is far too long because it is prolonging the suffering and the destruction of the economy. So really focusing on emulating the countries that are well governed, and not even highly well governed countries, right, that have done this and emerged in 6 months is a priority. The president, I think, if he focuses energy and attention of the administration in recovering soon and restructuring debt, that is the best thing that Sri Lanka can get done. In the meantime, he has to build, the challenge is to build a kind of credibility and confidence in government that will unlock bridge financing to support the supply of essentials, fuel, medication that are in short supply and adding to the pain and the reduction in economic activity. So Sri Lanka is posting probably the largest ever negative growth that it has posted in its history. The World Bank has predicted it to be negative 7.8. That's a few months ago. It could be as high as negative 10%. If the situation continues unchecked. So immediate action is needed to stop the slide of the economy, to take the renegotiation of debt seriously and put it on the fast train, not keep it on the slow train, and to support the poor with cash transfers, because life has become unbearable and will be unbearable for almost half of Sri Lanka's population.
We're going to have to leave it there. Gentlemen, thank you so much for your analysis and your observations. It's been a delight talking to both of you. We now turn to the COVID-19 pandemic and rising infections across Europe and the United States. According to the World Health Organization, the BA4 and BA5 subvariants of Omicron are fueling a global surge in cases. Joining us from Princeton, New Jersey is Scott Ratson. He's the Executive Director of Business Partners to Convince. That's a global initiative to promote COVID-19 vaccine acceptance. And Jeffrey Lazarus is a professor with the Barcelona Institute for Global Health in Spain. He's joining us from Baltimore, Maryland. And Jeffrey, why don't we begin with you? The WHO, of course, kind of sounding the alarm, saying, you know, we've got a situation where it's spiking in the U.S. and in Europe. And yet we're seeing restrictions lifted. The tracing and tracking and all of that seems to have gone out the window as well. The World Health Organization's regional director for Europe is sounding the alarm. Let's listen to what he had to say.
The virus has never gone away. People sometimes ask, is the virus back? It has never gone away. It's still there. It's spreading. It is mutating. And unfortunately, it's still taking a lot of lives. Last week alone, in our region, 3,000 people sadly passed away, and about 3 million new cases were reported.
Jeffrey, you just heard that rather alarming from Hans Kluge. I'm sure it's not a surprise to you, but what do you make of this? What are you seeing in Barcelona and across Spain and for all of Europe, for that matter?
Well, thank you. I fully agree with the World Health Organization's sounding the alarm, and I firmly agree with Dr. Kluge that the virus has not gone away. My only discrepancy would be that in addition to stressing mortality in new cases, I'd remind everyone of the importance of long COVID, persistent symptoms lasting more than 28 days. That's one of the big issues facing people, since we have such effective vaccines, severe symptoms are reduced, mortality is reduced. And there's really no coherence in the policy response across Europe. I've been visiting a number of countries over the last month and meeting with officials, but also concerned citizens and community groups who want to know why we're not preparing for future waves or even really addressing the current wave. And there's a lot we can do without moving towards, strong restrictions and draconian responses. We need to be improving indoor air quality. We need to be, retaining face masks, at least in areas where there's, greater chance of spread, like in transportation and other indoor areas where I think a face mask might not be a big problem in some of the shops and malls and so on.
And Jeffrey, of course, tourists back in big numbers in Europe this summer. And as you were talking about, these mask mandates seem to have been lifted just about everywhere. You looked at the UK, numbers spiking. I was just looking at Scotland last week. 1 in 16 people walking around in Scotland are infected with COVID. Those numbers are really alarming, and yet we don't see that sense of urgency that we saw early on in the pandemic. Why is that? And do you think at some point governments are going to have to kind of do lockdowns or do some kind of steps to try and slow the spread?
I think governments will have to take steps to slow the spread, or we're going to see this never-ending series of waves of infections. And there's multiple problems to that. In addition to, there is mortality and there are people who get severe symptoms. We have waning immunity from the vaccines and concerns about if people will take their boosters in the autumn, and governments aren't really preparing the population for that. So I think the governments, without calling for strong restrictions and lockdowns, need to prepare the population, remind them that this has not gone away, that there's a risk of variants of interest and particularly variants of concern. I was in the UK, a couple times over the last month. I was in Scotland, I was in London, and frankly, I came home with COVID-19, trying to protect myself the best I can. But in the end, we do go to restaurants, we do, go to airports and other places where there's a higher likelihood of spread. But I think the governments can do more also in terms of better communicating the risks and preparing us for, what may need to happen if there's continued pressure on the health systems. Right now, the NHS, the National Health System in the UK, is reporting a lot of pressure. Hospitals are filling up again. Healthcare personnel are being overstretched, in part because they're also getting COVID-19, so they're understaffed. And we're seeing this really across many parts of Europe, although right now the UK seems to be standing out.
Scott, let's talk a little bit about the United States. One epidemiologist described it as the Wild West with no real public health measures in place. Why do you think here in the U.S. as well, we're seeing everyone kind of letting their guard down?
Well, thank you for having me, and it's great to be here with Professor Lazarus, who also has history working with the World Health Organization. So he's speaking both with great expertise in his recent research, but also knowing what governments and World Health Organization can do. You're asking about the U.S., and much like what Professor Lazarus just said, We need governments to step up, but it's not just governments. It's these intergovernmental groups such as the World Health Organization. It's leaders in business. It's leaders in the media to take this seriously, that this virus is not going to go away. Professor Klug at WHO Europe was correct. We've heard similar things from all of the leading experts around the world. So we do need to pay attention. Now, the US CDC has been one of the flagship organizations with epidemiologists, not just in the United States and around the world, but frankly, it's both the surveillance and the communication and the public's response that's the challenge right now. So it's not on any one shoulder. I certainly wouldn't call it the Wild West, but I certainly believe we can do better. We can do better, and that's what we've been working on in the variety of roles that I have, both as a professor working with Professor Lazarus on activities, but also with business partners to get business to continue to take it seriously, follow mask mandates, put appropriate distancing and protective equipment in place, and help get back to predictability, which is what business wants, what the markets want, and frankly, what we all want to live in a safer and healthier world.
Jeffrey, let me get back to something you said, that you got COVID, and you kind of it was a throwaway line from you, yet if you said that early on in the pandemic, people would be like, oh my gosh. Is that part of the problem as well, that people are getting it? They've had vaccines, it's a mild case, and people think, well, it's not that big a deal. It's sort of like the cold or the flu. I mean, is that part of the problem we're facing as well?
It's absolutely part of the problem. I mean, I'm happy that is the problem, but it does have that double-edged sword that people don't treat the virus as seriously as they should. They don't understand the risks of mutations or the fact that it's always mutating. But when we have controls in place, the likelihood of a variant of concern spreading goes down. So yeah, it was a throwaway line, but I'll have to say I was really knocked out for 3 or 4 days, and I had a persistent cough for almost 2 weeks. And everyone asks, is it COVID? Is it COVID? But at the same time, you test negative and you kind of come back into society. One of the debates now is, is Omicron, or are the BA4 and BA5 variants, the subvariants that are in circulation, less virulent? And these are hard studies to carry out because so much of the population has been vaccinated, although we have major problems in some parts of the world and with some populations even where vaccines are highly accessible. But, is it because it's less virulent? Is it because we're vaccinated? Is it because of recent previous infection? Many people who say they've never had COVID-19 might have had it and just been asymptomatic. So there's a lot going on, but in the end, as you suggest, the population feels that this doesn't need to be taken as seriously. And certainly when we look back to 2020 and see, the high level of mortality back then, and that's not happening now, people just don't treat it as seriously. And our authorities are not taking advantage of this somewhat of a lull where we're pretty protected by the vaccines to prepare us for what we think may come, as possible to come in the autumn.
Jeffrey, let me ask you, what have we learned about COVID-19? Because, and also, what do we not know? Because you did bring up long COVID, and it seems like there's lots of studies out there, but there's still so much we don't know about it, right?
Yeah, I mean, this is a long answer. I'll give a short answer to a big question. I mean, we've learned, importantly, that we can develop vaccines quickly, that they're efficacious, that they're effective, and we need to get better at rolling them out, particularly with the boosters. And if we develop new formulations that are more effective, for Omicron and its subvariants. We don't know enough about long COVID. We still need to get agreed upon definitions, understand that there's more than 50 symptoms and be able to distinguish those symptoms from conditions, preconditions that people might have, or underlying conditions that people might have. We need to get better at communicating effectively, and we need really a sort of a whole of society and a whole of government approach. We need to get much better at engaging with the population, but also realizing that this is not solely a health systems issue. I mean, we have treatments, we have vaccines, but look at the situation. We're still in a situation where cases go up, and with that pressure on the health system, severe symptoms and mortality. So we're not going to get out of this through sort of biomedical solutions alone.
Scott, federal data showing that BA4, BA5 making up about 80% of the cases that we see here in the United States. The Biden administration now talking about perhaps extending this booster shot, the second booster shot, to all adults. Right now, I think it's 50 years and older. Why aren't we seeing more immediate action, do you think, from the FDA on this? And how important would that be to have everybody out there walking around with a second booster?
Well, first of all, we do know, and as Jeffrey mentioned, that vaccines work. And if you are vaccinated, you're 10 times more likely to be protected from ever being a case and 20 times more protected from fatalities. So the FDA and the CDC have been very stern in making recommendations quickly to get people first over 65 and now over 50 fully vaccinated, which means now a second booster. Now, this may need to go lower, and to be frank, we're not seeing as many people that are fully over 50 fully vaccinated. Some believe, well, I may have, as Jeffrey said, and myself as well, I'm vaccinated and also did contract COVID. And some people say, oh, I've contracted it, so I'm protected for a bit. But data have also showed that it's anywhere from 6 months, and even in Australia, maybe down to 4 weeks of protection that you might have from natural infection with BA4 or BA5. So it is important for the FDA and CDC to act. But secondly, it's not just them making a proclamation or a recommendation. This has to translate into medical practice. And that means physicians need to recommend it. That means we need to make it easier for people to get it in the United States when they get their annual flu shot or when they go to a drugstore to pick up a regular prescription. We need to make this the easiest way to protect yourself. And frankly, I don't think we have that happening well enough now. Now, having said that, there's also other options that we could put in place.
Well, Scott, let me finish with you. We only have about less than a minute right now. How do we change the mindset about vaccines? Because everything you just described is great, but there's still people out there that are very resistant to even getting one shot.
Well, you know, it's a short answer for a very difficult problem that we've been tracking, and the World Health Organization said it's one of the top 10 threats to global health. And we've seen the vaccination issue already translate into, unfortunately, lower child vaccination coverage. People are saying, I don't need to even get my kids vaccinated. And we have the first drop-off in over 30 years around the world of childhood vaccination, as reported by WHO and UNICEF last week. So I think we need to have an all-hands-on-deck. We need WHO, we need government, we need all of society, but we also need to remind the basic measures. We would still have polio on the planet in a way. There's a couple of places and cases a year, but not many because of vaccination. We've got rid of smallpox because of vaccination. We will be able to control COVID with vaccination, and these childhood vaccinated diseases, vaccine-preventable diseases such as measles, mumps, rubella, and others can be prevented. We need to remind people, and we need to get our politicians and our government officials an investment in place from all folks around the world. And that includes every country that we haven't been speaking about, but we all need to be engaged in this. And, you know, thank you for that very important question of building confidence and trust in our health system and our medical, scientific, and academic communities.
Well, gentlemen, a really important conversation, very important indeed. Thank you both for your insights. Appreciate it.
Thank you.
Thank you.
And that's all the time we have. Thanks to all our guests. I'm Mike Walter in Washington, D.C. Thanks so much for watching.